Hi, it's Dr. David Greene, founder and CEO of R3 Stem Cell, the global leader in regenerative therapies. All right, I'm continuing today with our FAQ video series, and I'm up to question number 14. How are the stem cells administered? All right, well, we customize each therapy for each patient's particular needs. And considering that we have 70 centers around the world in 7 countries that have performed over 26,000 stem cell procedures to date, we have a broad array of how our physicians decide to administer the stem cells. So let's go through the options. One would be simply an injection. If you have a problem with knee pain or tendinitis somewhere, predominantly an injection is going to be what's offered to you, all right? Now let's say you come to us in the Philippines or Turkey with COPD. What we're going to do is a combination of an intravenous stem cell infusion along with a nebulizer, all right? It's very effective. Okay, let's say you brought your child to us for a procedure for autism with stem cells. Typically what we will do is a combination of an IV infusion along with an injection into the back that's called intrathecal. And basically that's a reverse spinal tap type of procedure so that we can get millions of stem cells to the central nervous system. Same thing for a stroke or traumatic brain injury, spinal cord injury, things like that. All right, here's another option. Let's say while your child is being treated for autism in Mexico at one of our clinics, you also wanted to be treated for your back pain. So the combination that we use for back pain is called the regenerative trifecta. So you would be receiving a combination of PRP from your own blood, stem cells, mesenchymal stem cells, and stem cell exosomes being administered with direct injections into your facet joints of the low back, along with injections into the paraspinal musculature. So intramuscular is another way that we give injections. Now let's say you come to us in the Philippines and you're having brain fog secondary to a traumatic brain injury, but you really didn't want to get the intrathecal procedure. What else do we have to offer? Well, in that case, we would do a combination of an IV infusion along with an intranasal procedure with the stem cells. Very effective. Now, one last option would be if you come to us for a procedure for your face or hair, our providers may do a topical application of biologics. That could be along with a microneedling or possibly after a hair regeneration procedure. All right, so there you have it, a rundown of all the different application types that we use, including injection, IV infusion, intranasal, nebulizer, intrathecal, or topical. Visit us online today at r3stemcell.com and then call us to set up your free consultation at +1 844 GET STEM. You can also email us info@r3stemcell.com. Thank you.